Hey mama and mama to be, Dr. Nikki here with another video for ya. Today, by popular demand, I've had a couple of requests for pelvic floor stretching. So I am going to make this video about internal pelvic floor stretching versus another video which will be all about external pelvic floor stretching. So if you didn't guess it, internal pelvic floor stretching means you're going internal. You're using your finger and going inside of your vagina. So for those of you that makes you a little squeamish or uncomfortable, totally get it. However, you could use this as an opportunity to get to know yourself a little bit better. It is your body, so you have every right to explore it. So I am going to walk you through the basic steps of how to stretch your pelvic floor using your finger, your thumb to be more specific, and that will help with a lot of things actually. First, it will help with any sort of pain that you might be having down there. So pain in your bladder, pain in your vagina, pain in your butt, pain in your tailbone, anything in that pelvic region could be caused by tight pelvic floor muscles. So what do you do when a muscle's tight? You stretch it. So this is going to be excellent for you. Also, if you're postpartum and it's past the 6-week mark and you're still having some pain, some bladder leakage, this could help because it's possible that those things are still around because your pelvic floor muscles are tight. They could get tight from birth, from an episiotomy, or just the pain or tearing. And so it's important to wait until all of those tissues are healed before you do this. But this can be a very effective thing or tool that you could have at your disposal to help with those common postpartum issues. So without further ado, here we go. So like I said, you're going to use your thumb, your good old hitchhiker thumb, and I'm going to make a fake vagina with my hand here. So if this was your vaginal opening with a clean finger, or you can use gloves, and maybe a little bit of lube, so olive oil or coconut oil or just good old lube, you're going to coat the outside of the vagina and maybe coat your finger. And the way I like to suggest people to do it, so you're not shoving anything in anything, is you're just going to hang out. Take your thumb and just hang out at the vaginal opening. And you will find that with not much pressure at all, your finger will just slowly start to slide in. You are not shoving it in there. You're not pushing on anything. You're just hanging out and waiting for her to let you in. Then once you're in, about a knuckle or about the pad of your thumb, that's far enough. And you're gonna just hang out there. And you can use a little bit of pressure to press downward, like 6 o'clock. So if the vagina was a clock, 12 o'clock is straight up towards your pubic bone. Your urethra is there. So if you press upward toward 12 o'clock, you're probably going to feel like you got to pee. And then 6 o'clock is straight downwards towards your tailbone. And then 3 and 9 will be left and right, respectively. So if you were to hang out at that opening and wait for it to slowly go in, you can start by pressing straight down very gently. Very gently. A little goes a long way. Less is more. How many other phrases can I come up with to get that point across? But really, you don't want to be hurting yourself. This shouldn't hurt. You might feel a little tenderness, like you're pressing on a bruise, but not pain, okay? So, fingers in, you'll gently press downwards towards your tailbone, towards 6 o'clock, and hold it there. Count to 10, count to 20. Hold it there for a minute. Breathe. And then slowly take your finger off. And then you can change your angle like you're going to 8 o'clock. And gently press and hold and breathe. And then go to 7 o'clock and repeat. And I suggest you do this along the clock this way. So from 9 to 6 to 3. You want to avoid the top numbers, so you're not going to take your finger nail up and go upward. It's just going to make you feel like you got to pee and there's really no point. So that's basically how you stretch your pelvic floor muscles internally using your thumb. I'll go over it one more time for review. Vagina. Clean thumb or gloved thumb, little bit of lube, hang out at the opening, wait for her to let you in, and then very gently press downwards. You're going to stop if this causes any pain whatsoever. Again, less is more. So you'll gently press along the clock, 9, 8, 7, 6, 5, 4, and 3. You can feel free to hang out anywhere from 10 seconds to a minute at each number and progress as tolerated. I have found that the best positions to do this is either sitting on the toilet because your pants are already down anyway and it's easy access as long as your hands are clean, or semi-reclined in bed or on the couch. You really don't want to be lying flat because unless you got super long arms, it's kind of hard to reach that area comfortably without creating too much tension in your arm. So sitting up or propped up on the couch is excellent. Again, excellent for bladder leakage, any kind of pelvic pain, pain with intercourse and constipation, and tailbone pain during pregnancy and postpartum. So if you have any other questions about that, feel free to reach out to me, and I will see you in the next video.